Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Really important topic that I'm going to cover today, Bell's palsy or facial nerve paralysis, where the facial nerve, which is cranial nerve 7, doesn't innervate the muscles that cause us to smile. So basically here, this is kind of cool that like Izzy did this. She did just a great job with that. I love color, as you guys probably know. And here's the facial nerve. So the facial nerve innervates the muscles that make us smile. So Bell's palsy is basically when there's drooping of the face. So there are different muscles that help us smile. Sorridi is the Italian word for smile. So Patrizio sung the song Sorridi, and during difficult times that Mary and I have had in our lives, that song has given us a lot of hope. Because basically in the song it says that no matter what you're going through, sometimes you just have to smile even if you don't feel like it, because there is going to be a new day and things can get better the next day. And smiling or being positive always has a better effect than being gloomy and bitter and sad. So symptoms of Bell's palsy. Bell's palsy is basically where the nerve transmission through the facial nerve isn't occurring. So wherever the facial nerve goes, you can get symptoms. So the most common symptom is a person notices weakness, or they can't blink their eye, or they can't smile in one part of their face. You could slur your words, you can get a headache, your eyes can get irritated because you don't realize that several times a minute you blink, right? And the blinking has to do with tear production and covering your eye with a film. So basically the eyes get irritated when you can't blink. So even blinking, it's difficult to eat when the facial nerve isn't working. The facial nerve innervates 3/4 of your tongue as it relates to taste. So you can lose taste with facial nerve palsy. You can get ear pain, you can get sound sensitivity because the facial nerve innervates certain muscles that have, like the stapedius muscle, that has to do with having us be able to tolerate the sound of our own voice or loud sound. So there's muscles that dampen loud sound so they don't hurt. And this is basically, you could see where there's facial nerve palsy here on one side. This slide is up here twice because I just want to talk about, you know that there may be a TMJ component to Bell's palsy or a neck component to Bell's palsy when there's other symptoms. So the question is basically, what causes facial nerve palsy or Bell's palsy? If you go on Google, you'll see many cases. There's no known etiology. So I'm going to just say that based on Hauser's law number 2. So the second Hauser's law is that if you have a symptom, a chronic symptom, and you don't know the etiology, if you follow the neurology will lead to ligamentous joint instability. So in other words, if you follow the path of the facial nerve, it's going to lead to the cranial cervical junction or the temporomandibular joint. So somebody who has Bell's palsy on one side and they have a history of clicking, popping, grinding of that jaw, the ligamentous joint instability, the TMJ syndrome, could be part of why they got Bell's palsy. And as you'll see, the facial nerve exits the brain basically through a little foramen called the stylomastoid foramen. And that foramen is right at the cranial cervical junction, and it runs right by the styloid. And I think elongated styloids play a role with Bell's palsy, as I'll show you. But if somebody has other signs or symptoms compatible with ligamentous upper cervical instability, is your digestive tract not working? Do you get tachycardia? Do you get lightheadedness, head pressure, blurry vision. All these things can occur from ligamentous cervical instability causing block of the jugular vein or vagus nerve degeneration. And as you'll see, the vagus nerve has some connections with the facial nerve and the other cranial nerves. This is a really good illustration because see, the facial nerve comes out of the stylomastoid foramen right here, and see this styloid. Many people that I see in the office here for various complaints, including Bell's palsy, they have elongated styloids. So you can see that if this thing was huge, it's going to be easier when the person flexes or they turn their head, that could cause compression stretch of the facial nerve. And I should say this, overall about 70% of people who get Bell's palsy actually recover completely. And there was a study, I think in the year 2007 in the New England Journal of Medicine that showed that if you take steroids really quickly at the start of the Bell's palsy, the recovery was significantly greater. So it upped it another 10 to 15%. So it's not a bad idea when you get, if you get an acute case of Bell's palsy, especially if there's complete paralysis. Like when somebody has complete paralysis, they don't have any ability to smile at all. The complete recovery rate is only something like 61% or so, where if you just have weakness at the start of the Bell's palsy, like you can raise the corner of your lip a little bit, the prognosis is a lot better. But even when I was in training at Hines VA Hospital in Chicagoland, and we would get acute cases of Bell's palsy, it was common even back then to give oral steroids, and that's still kind of the standard of care. Even though some people recover completely without the steroids, it does seem to significantly help. And you might say, well, why is that? Well, if you have a styloid smashing on the facial nerve, or the jaw is hitting or somehow compressing the facial nerve, it's going to inflame the facial nerve. So sometimes a nerve isn't damaged, it's just that the nerve impulses are getting blocked. So if you have blocked nerve impulses where there's not damage to the nerve, then steroids, you could see where it'll decrease the inflammation. Now, if it's caused by ligamentous joint instability, such as a misalignment of the atlas or upper cervical instability or jaw instability, that's when we would initiate prolotherapy. And obviously, if somebody has an elongated styloid, that should be addressed. So the way you can tell whether your styloids are normal length or they're elongated is an upright cone beam CT scan or a CT scan of the neck and the cranial cervical junction, and then you can measure the actual length of the styloid. This just shows how close the facial nerve is to the vagus nerve. So again, if somebody had facial nerve paralysis, I would ask them questions regarding, do they have other signs or symptoms compatible with a vagus nerve issue? If a person has a vagus nerve issue plus a facial nerve issue, well, what could cause both of those? Could be a problem in the cranial cervical junction, not only an elongated styloid, but upper cervical instability. And you could see right here where the facial nerve runs right across the temporomandibular joint, and that's what this one shows. Hopefully you can see it. The facial nerve runs right across the temporomandibular joint, and when that is unstable, there's popping, clicking, grinding. When a person smiles with ligamentous temporomandibular joint instability, the mandible right here, it pops out. Well, when it pops out, right, they get a pop and it pops out, it could possibly stretch and compress the facial nerve. And this is just, again, you see this is on the side here, the facial nerve is going to all the muscles that cause you to smile, and you could see where some components of the facial nerve run right across the temporomandibular joint. The joint is supported by ligaments, so when the ligaments are stretched out, the articular disc in the TMJ can click in and out, and that's what causes the clicking. To me, a really good treatment for temporomandibular joint syndrome is prolotherapy. It works very, very good. This was data, we accumulated data on 709 patients, 14 had TMJ, and you could see that there was a significant relief of the pain. And again, TMJ dysfunction causes a stretching of one of the ligaments that can increase the force on the malleus inside the inner ear, so you can get hearing distortion. So anyone who has a history of Bell's palsy, but they also have problems with hearing, sound sensitivity, a clicking sensation inside the ear, which is called myoclonus, that would lend support to the notion that the problem is ligamentous TMJ dysfunction. When there's increased stress on the stylomandibular ligament, so there's a ligament that goes from the styloid to the mandible, so that ligament is under stretch and increased pressure by jutting the jaw forward, which a lot of you are doing right now watching me, right? When you're looking at your cell phone, you're jutting forward. So if you ask me what causes an elongated styloid or that styloid to grow, it doesn't really grow. The ligament gets calcified, the stylomandibular ligament gets calcified. What causes that is basically the jutting forward, because the ligament attaches from here to the mandible. So the more forward your mandible, the more force on that, and that's likely what causes the calcification. The problem is an elongated styloid, that extra ½ an inch that an elongated styloid is. I mean, some of the styloids we see in the office here are 3 inches, right? They're humongous. They can even compress the carotid artery. We've had a couple of cases like that. But for sure, they can compress the jugular veins, injure vagus nerves, and since the facial nerve runs very close to those styloids, when a person gets a styloidectomy, because occasionally people need styloidectomies, what takes the surgeon the 2 hours or so to do the operation is the surgeon has to get the facial nerve out of the way, because the main risk with styloidectomy is that you can basically get Bell's palsy or facial nerve paralysis. So that's kind of the main thing related to that operation. So that kind of confirms that the styloid can be the cause of Bell's palsy. When somebody gets Bell's palsy, it's important to try to figure out what are some contributing factors to it. So some of the contributing factors that I covered here was TMJ instability, upper cervical instability, elongated styloid. And my friends who do upper cervical chiropractic care would say misaligned atlas. That can also be a contributing factor to Bell's palsy. So if you or a loved one has Bell's palsy, I'd recommend to get an evaluation by somebody who's familiar with the structural causes of Bell's palsy. And the current data does support the use of steroids, especially within the first 3 days of getting Bell's palsy, because it does seem to enhance recovery. And if there's a structural issue associated with it, getting the proper care for that structural issue is also something that should be very helpful.